Is this spotting or a period? Is this spotting or a period? In this video today, we are going to answer the question, what is the difference between a period and spotting? You are a woman and you are experiencing changes in your system. You are seeing something that is disturbing you and you are asking yourself, is this spotting or a period? Gerard Massa, the health educator, is the name of the channel, and on this channel we do create awareness about fertility and reproductive health. Mu video yaffe eno leero tugenda kwogera ku njawulo ki eri mu kubanga olabye omusaayi nga gwa periods oba olabye omusaayi naye ng'ate tukiyita spotting, ng'ekyo ekibaddewo tukiyita spotting. So without further ado, we shall go straight away to the periods. We are going to answer this question in two parts. We shall first of all discuss part by part. We shall look at the periods, what happens during the periods, and then we shall also discuss spotting, what happens during spotting. The most important thing we need to take from this video is that the difference is always there, much as you'll be seeing blood on your pant liners or you'll be seeing blood on your knickers as a woman, but always there's a difference. Now, during periods, or how do your periods happen? We've talked about the anterior pituitary gland. This is a part in your brain which is responsible for releasing hormones which are actually chemical messengers in your body. Hormones are chemical messengers in your body. What they do specifically, they bring about changes. The hormones for the breasts, specifically it's called prolactin, the hormone for the breasts, when it is released in sufficient quantities, it brings about changes. In the physical, you'll see your breasts being normal. If it is released in excessive quantities, then you will actually experience also changes in the physical. But today we are not talking about changes of prolactin. We are talking about, is it spotting or a period? What's the difference between spotting and a period? So when the anterior pituitary gland, this is a part of your brain, when it releases the hormones FSH and LH, these hormones travel to your ovaries and they actually bring about changes. Now, we shall understand that for periods to happen, there should be actually changes in your hormones. The first hormone we are looking at is the hormone known as estrogen. Estrogen, abbreviated as E2, some doctors call it estradiol. In most cases, when it is released in sufficient quantities, you will not see your periods. But when it rises, that is after the second 2 weeks, let's say you started your periods today and then you actually finished the 2 weeks, on the 14th day you're going to be ovulating. But after ovulation, the next 2 weeks, that phase of your menstrual cycle is what we call the luteal phase. So when the estrogen hormone rises and then maybe you did not get pregnant, this estrogen hormone is going to drop. The levels of estrogen are going to drop in your body, and what is going to happen is that when the levels of the estrogen hormone drops, then also progesterone is also going to drop, assuming that you were not pregnant. Because if you get pregnant, the levels of progesterone hormone are going to continue rising. They will be produced by a particular part which is known as the corpus luteum. But today we are talking about periods. We shall not go into that. So what we need to take from this video is that spotting and periods, there's always a difference. We are talking about periods, how they happen. We've said that these periods happen because when you were expected to get pregnant and you did not get pregnant, the estrogen hormone is going to drop. The levels of estrogen hormone are going to drop. And when they drop, automatically the inside of your uterus or your uterine lining is going to shed. It's going to shed itself, and that shedding is what we call periods. So the shedding or your periods are normally heavier, and whereas in spotting there's always light bleeding, which actually may be having also a light color, and it lasts for only 1 day or 2 days. But also we need to take note that the biggest difference between periods and spotting is that in spotting there's light bleeding, and the color is always lighter. Whereas in your periods, if you are experiencing your periods, ideally the bleeding is going to be heavy, whereby it will actually fill up a tampon or even your sanitary pad. So the first difference between periods, or the first way you can tell that this is your periods or this is spotting, is that you look at the heaviness and then you look at the color. One is lighter, then one is darker. If you are a woman out there and you are experiencing heavy bleeding 2, 3, 4 days, then this could be your periods. But remember, if you have been having normal periods and then all of a sudden your periods have gone to 1 day, we've done a video about this. You can go to the library after watching this lesson. You can go through that video. But simply we shall talk about it. If you have been having your normal periods and then all of a sudden your periods become shorter, then you do not need to wait. This could be an indication that there's something happening. You could actually be pregnant, or you could be having hormonal changes, or you could be overstressed, or you could be having disease of the womb, and also you could be having an ectopic pregnancy. So whenever you as a woman see blood coming out from your system, whenever you experience bleeding, please do not take it to be just as usual. More specifically, if there are changes in your periods, if your periods become irregular all of a sudden, and then also the periods become heavier than normal, you should have yourself checked out at your doctor. Your doctor should do some tests on you to confirm what could be happening. So the first sign or the first difference between your periods is the heaviness and then the lightness. Tugambye nti omukyala wabanga alabye periods ze, ekisookebwako ekisobola otuleetera okuba nga twawula oba zino periods oba zino si periods, kyekyokuba nti omusaayi oguba gufuluma mu periods guba mungi nnyo nnyo nnyo. Ate of course nti buli mukyala oba buli mukazi afuna omusaayi oguli very heavy, naye nga at least guba mungiko okusinga mu spotting omusaayi guba mutini. So next is we are looking at the signs. What happens when you are going to see your periods? Excuse me. What happens when you're going to see your periods? When you are about to see your periods, normally you are going to experience fatigue. You will actually also experience abdominal pains, or also we call them cramps. And then you could also experience mood swings. But remember, as I said in the beginning, there's a very slight difference between your periods and bloating. So your periods and spotting. So also, if you are experiencing spotting, it could be that still you are maybe experiencing ovulation. It could be a sign, the spotting could be a sign that you are ovulating. The spotting could be a sign of conditions like polycystic ovarian syndrome. Spotting could also indicate that you could be pregnant. And then spotting could indicate that you have fibroids, or even you could actually be on birth control medications, because there are many birth control medications out there. And when you look at the leaflets, you realize that bleeding, or mild spotting or light spotting, is among the side effects of many of the birth control pills. So if you experience breast tenderness, you experience cramps, you also experience fatigue and mood swings, and even you feel abdominal fullness, then there are high chances that you could be having, or you could be going into your periods, although the same symptoms or the same signs are for spotting also. So the only way to differentiate between spotting and periods, or the only way to differentiate, assuming you've gone to hospital and your main complaint is you are seeing bleeding, you are bleeding or you are spotting, what your doctor is most likely going to do, your doctor will first of all request for some tests. The first simple test we normally look at for every woman who is spotting or having heavy bleeding, to differentiate whether this is a pregnancy or it's bleeding due to something else, we do what we call a urine HCG pregnancy test. A urine HCG pregnancy test specifically looks for the hormone. It's known as the human chorionic gonadotropin hormone, HCG hormone. So if this test is done on you, and then it turns out to be positive, then there are high chances that actually you are pregnant. If the test turns out to be positive, you are actually most likely to be pregnant. I'm saying most likely because there are some other conditions which bring about false positive pregnancy tests. These conditions could be that you could be on some drugs which actually can give false positive results. You could also be having some issues like maybe myomas or swellings or tumors in your system. So the only way or the first test your doctor will request is the urine pregnancy test. If it turns positive or if it gives a faint positive, then your doctor will go ahead and request for the serum HCG pregnancy test. By serum, we mean a sample of your blood is taken, around 1 or 2 mils, is taken in a purple top container. Your doctor will do all this, a small container which is always available in hospital. And then this sample will be tested. After being run through a machine known as a centrifuge, still this is more of medical, but just know that a small sample of your blood is taken, and then it will be tested for the same hormone, the HCG hormone. If the serum HCG pregnancy test or the blood pregnancy test turns out to be positive, then you are pregnant. It confirms that the bleeding or the spotting you are experiencing is due to pregnancy. But still, infections like PIDs or pelvic inflammatory diseases do also cause bleeding. They do also cause spotting. So you do not need to sit at home. You should see your doctor who will do these tests. The first test to be done to confirm whether you could be having a PID is that no, it's not the first test. We've talked about the urine pregnancy test. We've talked about the serum or the blood pregnancy test. Now, the third test is what we call the urine analysis test. Urine analysis test. Analysis means that a sample of your urine will be taken in a small container, and then the studies will be done on you. I mean, they will be done on the urine. These tests will be done on the urine to look for changes in your urine, as the word analysis implies. It implies that the whole sample of your urine will be analyzed for changes. These changes could include things like presence of white blood cells, presence of white blood cells. These are also called the leukocytes, depending on the hospital where the tests are being done. And then also, if at all this test is done, the urine analysis test is done, and then your urine report shows that you have pus cells, you have pus in your urine. Though it may not be visible with your eyes physically, you may not be able to see, but under a microscope, under testing in the lab, if at all pus is seen, or if pus cells are seen, then it could also raise question marks. If blood cells are seen in your urine, still it could raise questions as to why you have blood in your urine. And now your doctor will need to do more evaluation on you. And then lastly, the urine analysis test specifically looks at presence of other parameters. For example, if the urine analysis test shows that you have yeast cells in your system, in your urine, then it means that there are high chances that you could be having an infection which is really so serious that it is actually leading to release of yeast cells in your urine. And most likely, this could be a fungal infection. Talking about fungus, fungus is really a stubborn infection. In hospital, it may actually not respond to the conventional antibiotics which are always given. You do the urine analysis test, you do the urine, they call it a test for infection, and then it turns out to be really showing that things are not good. Your doctor gives you antibiotics. You may take antibiotics year after year, but you may not get better. Why? Because what you are taking antibiotics for may not be something that needs antibiotics. It may be something that needs antifungals. So always see your doctor before you actually take any medication. Avoid self-medication. Do not self-medicate. Always talk to your doctor who will advise you, who will give you expert advice. Talking about the last test which will be done on you, if at all the bleeding is there, I mean you've done the urine pregnancy test, it's negative, or it is positive. You've done the urine analysis test, it is also showing changes, or it is even normal. your doctor is going to request for one last test. And so there are other tests which may be done depending on the country where you are, but your doctor will most likely request for a pelvic ultrasound scan, or also known as a gynecologic ultrasound scan. Here, it will give pictures or images of your reproductive system, presence of free fluid in a particular part known as a recto-urinary pouch, or the pouch of Douglas, confirms that you could be having a PID, or also you could be having endometritis. Let me answer all your questions down below in the comments. Ask me all your questions about fertility, and I will be very happy to answer them. Thank you for attending our lesson for today, and see you in my next video. Remember to subscribe so that you do not miss new videos we release every day about fertility and reproductive health. A blighted ovum. What is a blighted ovum? What is an embryonic pregnancy? In this video today, we are going to answer all your questions about a blighted ovum. Have you done an ultrasound scan and your doctor has told you that you have a blighted ovum? In this video, we are talking about all this. After this short break, we are talking about a blighted ovum. Mu video yaffe ya leero tugenda kwogera ku kiki ekitegeezebwa bwe baba dokita wo akugambye nti olina blighted ovum. When a woman gets pregnant, a fertilized egg travels through the fallopian tube up to your uterus or your womb, where it attaches or it implants onto the uterine wall. Now, after attachment, there's going to be burrowing or digging of this fertilized egg as it is attaching onto the wall. And then this digging will result into a gestational sac forming. Now, a gestational sac is supposed to grow, and also there should be an embryo in the following weeks, that is around week 6 up to week 7, week 8. But if no embryo forms, then we call this a blighted ovum. Tugambye nti omukyala wafuna olubuto, bingi ebikyuka mu mbeera ey'anabaana, eggi lino eribadde fertilized lijja paka ne lyekwata ku kisenge ky'anabaana ne litandika okukula. We liba likuze, liba ligenda kubeeramu omwana oba kye tuyita embryo. Omwana waba tagenzeemu, kino kye tuyita a blighted ovum. A blighted ovum is a gestational sac or is a pregnancy with no live embryo at around 8 or 10 weeks. So, if you have done the ultrasound scan and your doctor has told you that there's a blighted ovum, it means that the baby's sac has formed, but the embryo is not yet there, or the embryo failed to form. At what age do you confirm that you could be having a blighted ovum? You are supposed to confirm that you could be having a blighted ovum at around 8 weeks, or even in some countries, they do confirmation at around 10 weeks. But in some countries, they actually do confirm even at around 7 weeks. So basically, at around 7 weeks or 8 weeks, maximum being 10 weeks, there should be an embryo. If there's no embryo, then it means that it's a blighted ovum. So what can you do if at all your doctor has told you that you could be having a blighted ovum? Normally, what your doctor will tell you is that you can actually wait for the uterus to expel the contents itself. But if at all you want it to be managed in hospital, then normally a special procedure known as a dilatation and curettage can be done by your doctor. Tugambye nti obanga obadde oli lubuto, nobanga ate olubuto lukuze, olina okubanga olindamuko ne tulaba singa oba doctor waba akugambye nti olina blighted ovum. Naye singa luba teruvudde mulooka, then doctor wo aba asobola okuba nga akola procedure gye bayita D&C n'aba nga akoozaamu munabaana. So if you do an ultrasound scan and it confirms that you could be having, it says that you could be having a blighted ovum at around 7 weeks, we always advise that you can at least be patient for the next 2 weeks, and as you're waiting, you should actually talk to your doctor about some supplements, for example multivitamins and folic supplements, folic acid supplements. These can help in the early growth of the embryo, also known as embryogenesis. But if at all you take the folic acid, wait for the 2 weeks, then you repeat the scan and it still shows that you could be having a blighted ovum, then you should follow what your doctor will tell you, where they will do cleaning of your womb. But still remember, there are many women who have had a blighted ovum, but they've gone ahead and had successful pregnancies. Gerard Massa, the health educator, is the name of the channel, and I welcome you for today's video lesson. I hope you've learned something about a blighted ovum. Ask me all your questions down below the comments of this video. You can also connect with me on my WhatsApp. Ovulation is the release of a mature egg known as a Graafian follicle on the 14th day of your menstrual cycle. This egg goes on and it gets fertilized. When it is fertilized, this very egg goes on and grows into a baby. Now, when this egg attaches itself onto your uterine wall or your womb, we call this an intrauterine pregnancy. If this fertilized egg remains in your tubes or your fallopian tubes, then it becomes what we call an ectopic pregnancy. If this egg is attached onto your uterine wall, it grows into a pregnancy. There will be a gestational sac or the sac of the baby, but if the embryo fails to go into the sac, then we call this a blighted ovum. Do you have any questions about fertility? Would you like to know about pregnancy, how you can get pregnant faster? Have you been asking yourself, why are you feeling that abdominal pain? Then you are in the right place. On this channel, we do create awareness about fertility and reproductive health. Gerard Massa, the health educator, are my names, are the names of the channel, and I welcome you for this lesson today. Remember to ask me all your questions down below in the comments, and I will answer all your questions definitely very fast. Thank you for watching today's video. I hope you have learned something in today's video lesson. If you have any question about fertility, about reproductive health, or about how you can get pregnant faster naturally, then just go down the comment section of this video and ask your question. I will answer all your questions. Nsanyuse nnyo mukwano gwange okubanga obadde naffe leero. Oba olina ekibuuzo kyonna kyonna ekikwatagana ku video gy'olabye leero, oba oyagala okubanga nkuddamu, beera nga ombuuza ebibuuzo byo mu comments eza video eno, nja kuba nkuddamu. Remember to subscribe so that you do not miss new videos we release every day. And then also remember to hit the like button so that we reach more people here on YouTube. Have yourself a fantastic and healthy day, and remember to donate to support our work. May God bless and protect us all. Bye-bye. What is a blighted ovum? How can it be cured? And could you talk about a blighted ovum? One of our friends called Ramoroka asked a question, and she wanted to know what a blighted ovum is. In this video today, we are going to talk about everything. We are going to talk about a blighted ovum and how can it be caused, and then the other thing is how can it be treated. Welcome to our channel, Gerard Massa, the health educator, and on this channel we do talk about fertility, we do talk about reproductive health, we create awareness. Without further ado, we shall begin by defining what a blighted ovum is. A blighted ovum is when the pregnancy happens, when fertilization takes place, the gestational sac forms, that is the sac of the baby, it forms, but inside the sac there's no live embryo. A blighted ovum, also known as an embryonic pregnancy, is when fertilization takes place. You get pregnant, a woman gets pregnant, but inside the baby's sac, where the baby is supposed to grow from, there's nothing. It is an empty gestational sac. In simple terms, we could actually call it an empty gestational sac. It is a condition which is so common nowadays, and many women are going to hospitals doing the ultrasound scans, but the results are coming out and they are showing that they could be having, or they have, a blighted ovum. How can you know that you have a blighted ovum? How can you confirm that you have a blighted ovum? The best way to confirm that you could be having a blighted ovum is by doing what we call a pelvic ultrasound scan. A pelvic ultrasound scan is an examination or a test whereby your doctor will apply some little liquid or gel on your abdomen, and then by the use of a special machine, also known as an ultrasound scan machine, images will be acquired onto the screen and your doctor will interpret these images. Of course, if the gestational sac is present, as we said, and it is actually measuring around 1 to 2 centimeters, giving an estimation of at least around 7 weeks, 8 weeks, or even 9 weeks, and yet at 9 weeks or at 8 weeks, there's no live embryo inside the baby sac. We call that a blighted ovum or an embryonic pregnancy. Now, our friend Ramoroka asked a question and she said, how can it be cured? One thing we have to take, or one thing we should take from this video, is that blighted ovums have no cure. The only thing that will be done with a blighted ovum when it has been confirmed is your doctor will most likely advise you to do what we call watch and wait. Watch and wait means your doctor will definitely discharge you home and then tell you to wait. If at all it is really confirmed that it's a blighted ovum, normally it comes out naturally. But if at all it is actually a blighted ovum and you do wait for at least 2 weeks, 3 weeks, or even 4 weeks, and the pregnancy has not, the sac has not come out by itself, then your doctor might recommend some procedures to be done in hospital, and these include one known as one called the dilatation and curettage, and then there's also another one called a manual vacuum aspiration, abbreviated as an MVA. So still, if at all it is at your doctor's discretion, your doctor might also opt to put you on medications which will cause contractions of the uterus and the sac will come out by itself. But always, most likely your doctor will advise that you go home and you wait for it to come out naturally. A really not pleasant situation here. It is blighted ovum is not really a pleasant situation. It is a depressing moment for the whole family, and at this moment always it's very advisable for you to stay strong, to remain strong despite the hard times you'll be going through, losing the early pregnancy, having to hear the news that the pregnancy did not form. But the most important thing you should note is that there's a big percentage of women, there's a big percentage of couples that go on and actually have successful pregnancies. What are the causes of a blighted ovum? The causes of a blighted ovum are idiopathic. Idiopathic means they actually, up to now, it has not yet been discovered that this is a particular cause for a blighted ovum. It just happens. Things just happen and you ask yourself what could have caused this, but it is attributed that there could be some predisposing factors or factors putting you at risk of getting a blighted ovum, and these include genetic predispositions. It could be something connected with the genes, and then also it could also be an issue with poor sperm quality, and then also poor egg quality of the woman. It could also be attributed to exposure to some chemicals from factories, which can actually go on and affect the quality and the quantity of the sperms and the eggs. And these actually, since they are of poor quality, since their structure has been affected right from the word go, then it means that during fertilization there are high chances that you could easily end up with a blighted ovum. How can you tell that how can you confirm that you could be having issues with a blighted ovum? There's a test which is done. We've talked about the pelvic ultrasound scan. There's also another test. It's also known as the chromosomal chromosomal assay test. The chromosomal assay test, your chromosomes are taken in the lab, and then the scientists or the doctors will do an assay or an analysis of your chromosomes, and normally there could be a defect with your chromosomes along the X and X, or the X and Y chromosomes, and normally a report will be printed whereby they will identify where exactly the defect is, and then of course the fertility experts will advise you on what to do. We've talked about a blighted ovum in this video. We've talked about the causes. We've talked about how you can confirm that you could be having a blighted ovum, and we have said that you do what we call a pelvic ultrasound scan. Then you could also go on, if this test is available in your country, you can actually have your doctor can have you do what we call a chromosomal assay test. Gerard Massa, the health educator, is the name of the channel. I take this opportunity to thank you, my friend, for staying with me for this time when we were talking about a blighted ovum. Let me know if you have any questions in regards to a blighted ovum down below in the comments. Remember to subscribe so that you do not miss any new videos we release every day about fertility and reproductive health. On this channel, we create awareness about fertility and reproductive health. If you would like to have a private chat with me, to have me answer all your questions in regards to fertility, my consultation is only $10 payable through mobile money or Airtel money. You can always connect with me. My WhatsApp number is +256 701 797876. Talk with me, book your space so that we can talk more about how you can get pregnant faster. Thank you, and may God bless us all. Bye-bye. How can you tell that your cervix is open during ovulation? What are the symptoms of the cervix opening during ovulation? Would you like to know how you can tell that your cervix is open during ovulation? When you are ovulating, when can you tell that your cervix is open? In this video today, we are going to talk about all this. Keep it locked on our channel, Gerard Massa, the health educator, and on this channel, we do create awareness about fertility and reproductive health. Gerard Massa, the health educator, is the name of the channel. The symptoms of an open cervix during ovulation include you may actually begin to get signs of wetness coming out. You actually will experience wetness, and then the other thing is that your cervix will feel kind of soft, and then also you realize that your cervix will remain high up in your private parts, and then of course you will actually also realize that your cervix will tend to open. So what can you tell, or how can you tell that your cervix is open during ovulation? The first thing you need to note is that during ovulation, that's when a mature egg is released. So the most important thing you need to take from this video is that there's going to be what we call a show. Show has it has S, H, O, and W. S means that your cervix is going to be soft. And then H means that your cervix is going to be high. H stands for high. And then O, your cervix of course is going to be open. And then W stands for wetness. If you would like to remember the shortest form of how to tell that your cervix is actually open during ovulation, you specifically will need to know that it becomes soft, it remains high, and then it will be kind of wet. Gerard Massa, the health educator, is the name of this channel, and I welcome you, my friend. If it's your first time on our channel, remember to subscribe so that you do not miss any new videos we release every day. Mu video yaffe eno leero togedde ku signs ki z'osobola okubanga olabirako nti wandibanga olina omumwa n'abaana ogugudde oba oli mu kiseera ekituufu eky'okubanga osobola okufuna olubuto. Era tugambye nti ennyukuta ziri annya zooka kuliko S ekitegeeza nti nabannayo egenda kubanga kwegamba eri soft, ate n'ekirala egenda kubeera wet, egenda kuba eggonda nnyo, ate n'ekirala egenda kuba ng'eri waggulu eyo ejja kubanga kwegamba eri high. We've talked about the signs on how you can tell that the cervix is open. So we are proceeding with our video, and remember to ask me all your questions down below in the comments. If you have any questions, I welcome all those questions. I will be able to answer all your questions. And then also, if you would like to know more about fertility, you would like to schedule a private consultation with me, please kindly connect to my website, fertilityeducator.site. The address is just below this video, just above in this corner of this video, and then we will be able to do the booking for a private consultation with me. On this channel, we do create awareness about fertility and reproductive health. We've talked about the symptoms of how you can tell that the cervix is open during ovulation, and we've said that your cervix will be soft, it will be high, and then of course it will be open, and then there will be wetness. There will be a discharge which will be coming out from your private parts. Thank you for attending today's lesson. We've talked about cervix in ovulation, the state of your cervix in ovulation, and I hope you've taken something from this video. See you in my next video tomorrow, and we shall continue on our lessons, creating awareness about fertility and reproductive health. Gerard Massa, the Health Educator, is the name of the channel. Remember to subscribe so that you do not miss any new videos we release every day about fertility and reproductive health. Bye-bye. May God bless us all, and bye-bye. In this video today, we are going to answer a question that has been asked by one of our subscribers. Can fibroids affect your chances of getting pregnant? Can fibroids affect your chances of getting pregnant? Gerard Massa, the Health Educator, is the name of the channel. So without further ado, we shall need to understand what fibroids are. Fibroids are those swellings which actually tend to grow in your uterus. They could actually be inside your uterus, or they could be in the middle layers of your uterus, your uterine wall, and then also they could be outside your uterus. If these swellings or fibroids are outside your uterus, we call them pendiculated fibroids. And then if at all they are in between the layers, the myometrial walls, the layers of your uterus, we call them the intramural fibroids. And then if these swellings or fibroids are located inside your uterus, then we call them the submucosal fibroids. We call them the submucosal fibroids. So we've talked about the different types of fibroids. We've talked about the pendiculated fibroids. These are outside. Those in the middle layer, we call them the intramural. And then those inside, the innermost layer, we call them the submucosal fibroids. Having known that fibroids appear or they occur in different parts of your uterus, how do they affect your chances of getting pregnant? Or if you have fibroids, are you able to get pregnant? Mu video yaffe eno tuli kwogerako ebikika eky'ekirwadde oba eky'obulwadde kye bayita fibroids, era tugambye nti mulimu ebika bisatu ebya fibroids. Mulimu ekika ekisooka ekiba nti ebizimba bino bibeera munda munabaana, ate waliwo ebibeera ku makati aganabaana, then mulimu biri ebibeera muli munda mwennyini. Ebibeera munda bye tuyita submucosal fibroids, ebiddirira mu kinyama ekyo ekinene kye bayita myometrium, ebyo bye tuyita the intramural fibroids. Ate bino ebibeera ku mabbali, ebiba bifulumyeko ku mabbali, ebyo bye bayita pendiculated fibroids. We are talking about how fibroids can affect your chances of getting pregnant. And we have said that when you have fibroids, when you are having fibroids, there are high chances that probably you've taken long without getting pregnant, or you could have got pregnant, gave birth, but you've taken many years without getting pregnant again. What is going to happen is that the levels of the estrogen hormone are going to rise. The main reason why they are rising is that Ideally, in normal circumstances, your uterus expects you to you are expected to be getting pregnant, but maybe you take long without getting pregnant. There's going to be a surge of these hormones, and the hormones we are talking about include estrogen and, of course, even progesterone. But progesterone normally rises when you have got pregnant. It is a pregnancy-friendly hormone. But for the cases of estrogen, when you have your uterus or your uterine wall being exposed to long levels of the estrogen hormone, then there are high chances that you are going to end up with fibroids. So, in a nutshell, the real cause of fibroids is actually not yet discovered, but there are predisposing factors to a woman getting fibroids. The predisposing factors include taking long without getting pregnant, and then also, if at all you are in a scenario where you have persistent high estrogen hormone, then there are high chances that you could end up with fibroids. Gerard Massa, the health educator, is the name of the channel, and on this channel we do talk about fertility. We create awareness about fertility and reproductive health. If you have that burning question, you would like to talk with me in private and in privacy, and you would like to actually ask me all your questions related to fertility, you can go just below this video. The website is called fertilityeducator.site. You actually click that link, and then I'll be waiting for you. After you've done the booking, we shall consult, and then of course I will answer all your questions in regards to fertility and see how best you can get pregnant faster naturally. Tugambye nti osobolera ddala okuba ng'ofuna olubuto singa oba wazuulibwa nti olina ebizimba, naye olina okusooka n'omanya nti ebizimba bino bisobola okuba nga bijjanjabibwa, ate n'ekirala olina okumanya nti ebizimba bino bijja lwa hormones okuba nga tezibalansinga. Waliwo hormone gye bayita estrogen, kasita eba nga eri very high ate n'eba nga tekendedde, then chances nyingi ez'okuba nti omukyala aba asobola okufuna ebizimba. Gerard Massa, the health educator, is the name of the channel. I welcome you on our channel. Remember to subscribe so that you do not miss any new videos we put out every day about pregnancy, about fertility. See you in my next video, and have yourself a fantastic and blessed day. God bless. Bye-bye.
How to calculate your ovulation cycle, how to calculate your ovulation calendar, how to calculate your ovulation calendar, how to track your safe days and your danger days using the calendar method. Assuming you are seeing your periods on the first day, which is around this period on Monday, assuming your first day of your period is on 1st, which is Monday, and then you see your periods again on 2nd, you see your periods again on 3rd, that is Wednesday, and then also you see your periods on 4th. We want to use this method to identify the days you are going to ovulate. Remember, we've said that when you see your periods on day 1, that is on Monday, day 2, that is Tuesday, day 3, that is Wednesday, and day 4, that is Thursday. Just we are using this as an example, but it could be actually any other day of the week, but we are using this as an example. So in this particular case, you see your periods for 4 days, that is 1, 2, 3, 4. You started on 1st, which was Monday, and then you finished on Thursday, which is actually the 4th of Thursday. You want to know your ovulation days, the days you are most likely to get pregnant. We are supposed to do the counting. First of all, we shall understand what an ovulation cycle is. An ovulation cycle, or the ovulation day, the days of ovulation, are those days when a mature Graafian follicle or a mature egg is released, and the chances of getting pregnant are very, very high. So you saw your periods from 1st, 2nd, 3rd, and 4th. What we are supposed to do is to count the days from the first day of seeing the periods to the first day of the next period, assuming your next period is going to be around maybe 26th, 27th, 28th, okay, and maybe 24th when you are getting off your periods. assuming your next period is from 26th, 27th, 28th, and 29th. If you want to identify the days of ovulation, the days you are most likely to get pregnant, you are supposed to count from the first day when you saw your periods, count 14 days. And on the 14th day, add 3 days in front and add 3 days backwards. We are saying that to calculate your ovulation days, you count the first day when you saw your periods and you count 14 days. On the 14th day, add 3 days, subtract 3 days, and specifically those are the days you are most likely to get pregnant. We shall go and do it practically. Assuming you saw your periods here, this is the first day you saw your periods, that is Monday 1st. So we are going to count and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14. So according to this cycle, the 14th day is specifically here, and that is on Sunday. But according to our method, we said that when the egg has been released, or when ovulation is taking place at this 14th day is the peak period when you are most likely to get pregnant. We add 3 days in front. We say 1, 2, 3. Come back on the 14th day and we also add 3 days backwards and say 1, 2, 3. So the days you are most likely to get pregnant, or the days of ovulation, are from 11th, 12th, 13th, 14th, 15th, 16th, and 17th. Specifically 3 plus 3 you get 6, plus the 14th day, which is 1, you get 7. So it's always that week. It's always 1 week. To get this, we shall go backwards. We shall repeat this again for our friends who have not picked it. We said that to understand the days you are most likely to get pregnant, we start from the first day when you saw your periods. Assuming you saw your periods around here, the first day of seeing your periods, count from the first day when you saw your periods, count 14 days and say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And we've said that the 14th day is the day you are ovulating, but this process goes on for the next 3 days, and it also starts the first 3 days before you saw your 14th day. So you add 3 days in front, add 3 days backwards, and specifically from this period up to this period, those are your unsafe days, or your days of ovulation. If you do not get pregnant in around here, then the egg goes into what we call a corpus. It becomes what we call a corpus luteum, or a corpus luteal phase. The next 2 weeks are basically the egg which was supposed to become fertilized. The egg which was supposed to be fertilized, if it is not fertilized, the remaining follicle becomes what we call a corpus luteum. We shall talk about that in our next video, but in today's lecture, as I'm summarizing, we have been talking about how to calculate your ovulation cycle, how to calculate your ovulation days, how to track your safe days and your danger days using the calendar method. And we've said that simply to understand your menstrual cycle, you have to count from the first day when you saw your periods to the next day when you will see the next period. Thanks a lot for staying with me. Gerard Massa, the Health Educator, is the name of the channel.
How can you tell that your cervix is open during ovulation? What are the symptoms of the cervix opening during ovulation? Would you like to know how you can tell that your cervix is open during ovulation? When you are ovulating, when can you tell that your cervix is open? In this video today, we are going to talk about all this. Keep it locked on our channel, Gerard Massa, the Health Educator. And on this channel, we do create awareness about fertility and reproductive health. Gerard Massa, the Health Educator, is the name of the channel. The symptoms of an open cervix during ovulation include you may actually begin to get signs of wetness, coming out, you actually will experience wetness. And then the other thing is that your cervix will feel kind of soft, and then also you realize that your cervix will remain high up in your private parts. And then of course you will actually also realize that your cervix will tend to open. So what can you tell, or how can you tell that your cervix is open during ovulation? The first thing you need to note is that during ovulation, that's when a mature egg is released. So the most important thing you need to take from this video is that there's going to be what we call a show. Show has it has S, H, O, and W. S means that your cervix is going to be soft. And then H means that your cervix is going to be high. H stands for high. And then O, your cervix of course is going to be open. And then W stands for wetness. If you would like to remember the shortest form of how to tell that your cervix is actually open during ovulation, you specifically will need to know that it becomes soft, it remains high, and then it will be kind of wet. Gerard Massa, the health educator, is the name of this channel, and I welcome you, my friend. If it's your first time on our channel, remember to subscribe so that you do not miss any new videos we release every day. Mu video yaffe eno leero togedde ku signs ki z'osobola okubanga olabirako nti wandibanga olina omumagwa n'abaana ogugudde oba oli mu kiseera ekituufu ekyokubanga osobola okufuna olubuto. Era tugambye nti ennyukuta ziri annya zooka kuliko S ekitegeeza nti nabannayo egenda kubanga kwegamba eri soft, ate n'ekirala egenda kubeera wet, egenda kuba eggonda nnyo, ate n'ekirala egenda kuba ngeri waggulu eyo ejja kubanga kwegamba eri high. We've talked about the signs on how you can tell that the cervix is open. So we are proceeding with our video, and remember to ask me all your questions down below in the comments. If you have any questions, I welcome all those questions. I will be able to answer all your questions. And then also, if you would like to know more about fertility, you would like to schedule a private consultation with me, please kindly connect to my website, fertilityeducator.site. The address is just below this video, just above in this corner of this video, and then we will be able to do the booking for a private consultation with me. On this channel, we do create awareness about fertility and reproductive health. We've talked about the symptoms of how you can tell that the cervix is open during ovulation, and we've said that your cervix will be soft, it will be high, and then of course it will be open, and then there will be wetness. There will be a discharge which will be coming out from your private parts. Thank you for attending today's lesson. We've talked about cervix in ovulation, the state of your cervix in ovulation, and I hope you've taken something from this video. See you in my next video tomorrow, and we shall continue on our lessons, creating awareness about fertility and reproductive health. Gerard Massa, the health educator, is the name of the channel. Remember to subscribe so that you do not miss any new videos we release every day about fertility and reproductive health. Bye-bye. May God bless us all, and bye-bye. Ovulation is the release of a mature egg known as a Graafian follicle on the 14th day of your menstrual cycle. This egg goes on and it gets fertilized. When it is fertilized, this very egg goes on and grows into a baby. Now, when this egg attaches itself onto your uterine wall or your womb, we call this an intrauterine pregnancy. If this fertilized egg remains in your tubes or your fallopian tubes, then it becomes what we call an ectopic pregnancy. If this egg is attached onto your uterine wall, it grows into a pregnancy. There will be a gestational sac or the sac of the baby, but if the embryo fails to go into the sac, then we call this a blighted ovum. Do you have any questions about fertility? Would you like to know about pregnancy, how you can get pregnant faster? Have you been asking yourself, why are you feeling that abdominal pain? Then you are in the right place. On this channel, we do create awareness about fertility and reproductive health. Gerard Massa, the health educator, are my names, are the names of the channel, and I welcome you for this lesson today. Remember to ask me all your questions down below in the comments, and I will answer all your questions definitely very fast. Thank you for watching today's video. I hope you have learned something in today's video lesson. If you have any question about fertility, about reproductive health, or about how you can get pregnant faster naturally, then just go down the comment section of this video and ask your question. I will answer all your questions. Nsanyusa nnyo mukwano gwange okubanga obadde naffe leero. Oba olina ekibuuzo kyonna kyonna ekikwatagana ku video gy'olabye leero, oba oyagala okubanga nkuddamu, beera nga ombuuza ebibuuzo byo mu comments eza video eno, nja kuba nkuddamu. Remember to subscribe so that you do not miss new videos we release every day. And then also remember to hit the like button so that we reach more people here on YouTube. Have yourself a fantastic and healthy day, and remember to donate to support our work. May God bless and protect us all. Bye-bye.